Welcome back for the last time. In this video, we are going to talk about entering in labs, radiology interpretations, doctor's notes, entering in EKGs, and we will have some more clarification on macros. First, let's talk about entering in labs. This is a very simple process. When the doctor tells you to enter in labs, and only after he or she tells you to, you can click on the results button found on the chart. So we'll go ahead and click on this chart, and then you can see the results button right here. Whenever you click on the results button, there should be an arrow at the top. You can click on this, and then there will be a button that says Enter on Chart. If the labs have already been entered into the chart, you will not see this option. Unfortunately, as you can see here, this patient does not have any results, so we can't demonstrate this in our video, but the process is very self-explanatory, and when you see this on your training shift, it will make sense. Note that every doctor is different with these. Some like to enter them in themselves, and others don't have a preference. It is best for you to ask each individual doctor at the beginning of the shift if they like to enter in their own labs or if they would like to have you do it. Now let's move on to entering in radiology interpretations. So we'll go back to our main chart here. Once again, the doctor will tell you this information, or listen to the dictations from the radiologist and then pass the results over to you. You will insert the interpretation into the appropriate section. So we'll mosey down here to radiology interpretation and just click on that button, and you can enter it into the most appropriate section. Right here, you'll pick the best section that's applicable to the result. For example, let's say that the doctor told you there was a negative chest x-ray that he read that was completed and showed no pneumothorax. So you would go to radiology interpretation like we are here, click on chest x-ray negative, no pneumothorax. You can see all of these other buttons right here. You do not have to click those. I recommend asking the doctor if they want you to click on those or not, because they may prefer that you leave them alone. So we're done with our chest x-ray now, and another example that we'll use is, let's say that a patient had a CT abdomen pelvis, so it would be under abdomen, that showed appendicitis that was dictated by the radiologist. So in this example, you would either double click or right click, either option, because it is not negative. And then you would go here and click on appendicitis, and that's all you need to do there. So now you've inserted in the abdominal pelvis CT and the chest x-ray. But after you do both of those things, each time you insert in a radiology interpretation, you'll have to insert in who interpreted it. So you can find that down here at the bottom. So for our chest x-ray, it's a plain film, and we would say that was dictated by the physician. And our CT scan was dictated by the radiologist. So with a radiology interpretation comes an interpreter that must be inserted in. And then we've got all of our information. We're just going to hit enter. And when we do so, we can see the information will be carried over here to the left side of the screen. Okay. So let's go ahead and move on to doctor's notes. So you can access doctor's notes by clicking that button right there at the top. These doctor's notes are used for many reasons. If you click on them, you can see all of the options that you can use this note for. So you can see it goes down pretty deep here. Most commonly, I use doctor's notes as a progress note and to document phone calls. So let's say that you have already initially seen a patient and you go in for a recheck. You can document the update from the recheck in this free text portion seen here, or above in this area, whichever is easiest for you. So you would just document the conversation between the doctor and patient during that recheck in either of these two boxes. Another thing I use doctor's notes for is to document phone calls. You can do that under the D/W or discussed with section. So we'll go down here a little bit, and you will see, you can ignore the rest of this for the most part, but then you see this section, D/W. So here, if a patient was talked about on the phone by the doctor, you would go to the D/W section. You can put who the doctor talked with and what the conversation consisted of. And again, the doctor's name would go here, the conversation would go here. Most of the phone calls made by the doctor must be entered into the chart in this way. You can always ask the doctor who they talked to and what they discussed. And then once you've got your doctor's notes in, you would just click enter. It's that simple. So now we're going to move on to talking about EKGs. An EKG is a test that checks for problems with the electrical activity of the heart. It will be given to the doctor, and then he will read over it and hand it to you to enter into the chart. Always make sure that the doctor has signed the EKG before you put it into the computer. So let's say the doctor reads an EKG and hands you a copy. You will go here to the left side of your chart and click on EKG interpretation. When you do, it will pull up this box right here. You're always going to be concerned with the 12 lead, so you can always ignore monitor strip. So now focusing on this area, let's show that the EKG says the patient had a normal sinus rhythm with a rate of 77. So you would just hit normal sinus rhythm, and under rate you would hit 77. Let's say the EKG also said there was no ectopy, so we'd hit none. The EKG showed that conduction was normal, so we'd click that. ST segments were normal, we could click that. T waves are normal, and access is normal. So it was a normal EKG. That is what a normal EKG would look like. But let's also just pretend that the access was deviated to the right, just to give you an example of how to insert in an abnormal. So here we would double click or right click, and then we could just click right if that were the case. We're just going to leave it normal for now. And then once you've got all of your information in, including external information that you may not have a button for, which can go into this free text box if you need it, you will click enter. So now we'll see our EKG get carried over to the left side of the screen. And that's it. Now, the last portion of this video involves macros. I know that we said we would save them for your hands-on training for the most part, but we thought that we would give you a little bit more information to prepare you even more. As I said earlier, you can think of a macro as a template that you can enter into the chart over and over again with the click of a button. With the information that is used often, a macro can be very helpful and save you a lot of time. Macros are always used for the ROS and PE, and they can also be used for many other things as well. Before we go over how to make a macro, let's go over specifics of the ROS/PE macros. So, if I click on the macro button located here, you can see all of my personal macros in this section. You notice that I have ones for all of the doctors. Each time that you work with a doctor, you will use his or her personal macros for the ROS and PE, unless the doctor says otherwise. For a while, each time you work with a doctor for the first time, you will have to ask him or her for their macros, and they expect this. There are typically two levels of macros for the ROS/PE, as I said earlier, a level 3 and a level 5. You may have to ask the doctor which level to use. Also, macros are divided into male adult, male PD, and female PD specifications. You can choose the most appropriate one for the ROS/PE based on the level, sex, and age of the patient. Now, let's look through a random doctor's macros to show you these specifications. So let's say you are working with Dr. Goen or Dr. Schultz in this shift. You would click on this area whenever it comes time to insert in the ROS and the PE because you want to use his specific macros, and you can see all these different options here, and it can look a little daunting, but now that you know the specifications, you can weed out what you need very quickly. So you see we've got level 3 PE and ROS female. Then again, we have level 5 PE and ROS female. So you've got your two different levels. And in between, you've got just the PE, just the ROS, just the PE, just the ROS if you wanted one and not the other. You can see the same for the male. And then you see the same for the female PD and the same for the male PD. So you just go through and choose whichever type of macro it is you need for the ROS and the PE. Now that we've talked about the PE and the ROS macros, we can talk about other kinds of macros that you may be interested in making, because once again, macros can be made for any information that you personally enter into a chart. As I said earlier, most scribes use them for their scribe documentation and their CYA note. Another popular macro that some scribes use is for a normal EKG, since you enter those into the chart very often. In this portion of the video, I'm going to teach you how to make a macro by making a macro for a normal EKG. So now, referring to our EKG that we entered into the chart earlier, let's make a macro. So the first thing you'll do is you'll click macro right here, and then you can click new. So we'll click new. Then it gives you all of the options available so that you can make a macro from anything you personally entered into the chart. You can see all of this here. This is all of the charting that we've done in the previous videos that have been entered into the chart. And you can see that I can make a macro for any of it. Right now it's all selected, so I'm going to deselect all of it, and we're going to focus only on our EKG portion, since that's the part we concern ourselves with for this macro. So we can see that right here. So now I'm just going to click on this area only, because this is the only area that I want to make a macro of. And then I'll just click on macro name, and I'll be asked to name it. So I'm going to name this normal EKG. And then I'll hit save macro. And you can see now I have all my ROS and PE macros with the different doctors here. And then I have my normal EKG macro. Just so that you're not confused, I'll explain that these two areas here are my personal macros that I've made for the CYA note and the scribe documentation verification. And you would make those in the same way which I just described. So now, anytime that you have a normal EKG that the doctor states, you can click this normal EKG button, and the normal EKG will be entered into the chart without you having to go through like we did earlier and click on all the different buttons. Now it's just with the easy click of a button, the template gets entered into the chart. But there is a disclaimer. The rate will probably have to be changed each time because, as we know earlier, we put the rate was 77, and it is impossible that every patient that you use this normal EKG macro for will have a rate of 77. So then you could just go back in here, click on your template that you've entered in, and then you could change the rate to whatever it is, say 79 or whatever the new rate was that it was showing on the specific macro. But it's that simple. Now you know how to make a macro, and hopefully this extra information will be helpful to you during your shift. This concludes our training session. I know that it's been a lot of information, and I know that it can be overwhelming. But if you are feeling overwhelmed, please don't. We will all do our very best to make sure that you are all comfortable and answer any questions that we can during training. Keep in mind that it will come a lot easier when you are able to literally do the things that we talked about, which will come in the formal training. Thank you for listening, and I wish you the best of luck.